Hello and good evening, good morning, good afternoon, wherever you are watching this video and whenever you're watching this video. So we're starting our session on question and answers on mental health issues with Dr. Edebi. All through the month of April, every Monday in the month of April, we will be having this conversation on mental health issues. From my own personal experience, I have come to see that many times what people do not understand, they fear, and sometimes appropriate treatment is not sought because people don't understand what they are dealing with. So the goal of our conversation and the goal of this shows or editions or series and these conversations that we have put together is to primarily enlighten the public about issues on mental health, so that it becomes a conversation that people are not afraid to talk about. It's a conversation that people can open up and then also can understand. I like to just simply put it this way: it is an aim to literally to reduce the stigma around mental illness. So I am Dr. Tefe Edebi. I'm a consultant psychiatrist. I'm also a psychologist. I am the medical director of the Grace Hill Place Hospital. We started this last year in the midst of the COVID, and just come to think about it, this is 1 year since we started this. We do it every quarter, where every Monday in a particular month in the quarter, I take questions from anyone and everyone on mental health issues, strictly on mental health issues. And the goal, like I said, is to address the whole issue about mental health, and secondly also to empower people on self-help tools to improve their emotional well-being and just their self-development and self-improvement, because there is no health without mental health. On this show, if I may use the word, you are allowed to send in questions, so you can send in questions while I'm at it. It's just a 30 minutes program. Send in your questions and I will make attempt to answer all the questions that are sent in. You could also send in your questions before the program. As I speak, Evelyn is just going to put up the number that you can send in your questions before the show, so that I can prepare, think about them, and also answer them. Any question at all as far as mental health is concerned, and emotional well-being, and just general mental resilience, things that will help with stress management, things that will help with self-improvement. That is the conversation that we'll be having today. I've decided to take a particular topic. Interestingly for me, this is the first mental health situation. No, okay, not the first. It's the first mental health situation I experienced while coming into the mental health field as a resident doctor. That was about that's about 15 years ago. About 15 years, 14 years and more ago. That was I will be talking about bipolar affective disorder, but particularly I'll be talking about mania. Now, mania is said to be a mood disorder. Your mood just refers to your feelings and your thinking. So when we all experience moments where we're excited, we all experience moments where we are feeling low. But when you say the mood is out of sync, and when you say the mood is disordered, is when that feeling of excitement or that feeling of depression or that feeling of sadness is persistent and is also affecting one's quality of life and one's functioning, such that it may cause some level of distress either to the individual or to the people around them. Today, like I said earlier, I will focus on mania, which is a component in bipolar. Now, the word bipolar just simply means bipole, two poles, and another name for the word bipolar is another name for the condition called bipolar disorder is manic depressive disorder. So I will be talking more about the manic aspect of depression. And so I'm going to talk about how does it look like. How do I know that my loved one may be experiencing a manic episode? This is beneficial for those who may never have experienced it. Also, it's also beneficial for those who may already be diagnosed. How do I pick it up early? Because early intervention leads to a better outcome. So how do I know, how do I identify if my loved one is experiencing a manic episode, either for the first time or is about to have another manic episode? What are the things that I should look out for? How does mania look? There are three central things, but I'm going to break it down into how exactly it looks. How do you, when it begins to occur, how does it look, and what are the signs and the telltale signs to look out for? There are three key things. First of all, there is some level of elation of mood. So remember, I said your mood is your thinking and how you feel. So there is elation. There's a feeling of euphoria. There's a feeling of excessive happiness, or the person gets excited easily. Then also there is increased activity, and I'm going to explain it a bit further. And thirdly, there's a sense of self-importance that the person feels. So how does it look in everyday situation? Sorry, a call came in and it's affecting my so how does it look in everyday situation? First things first is the mood. How would the person look in terms of his mood? The person will be cheerful. The person will be in high spirits, and there is something that is peculiar about this high spirits. The old writers used to call it infectious gaiety, which means it's like they make everyone, it's like the joy that they have kind of just spreads around. Initially, it looks exciting. It looks like, oh, we're in a good place. The person may be singing. The person may just say, let's all be happy. The person may storm into a place or come into a family gathering and get everyone excited and just get everyone in good spirit. That's how it looks. But also, sometimes that could interject with short periods of low mood, weeping, and then the person is back to the excited state. Also, in terms of behavior, how would this person who is experiencing a manic episode look? Most times, people experiencing manic episode will have some, in terms of their dressing, you may find them changing their clothes quite often. You may find them wearing very bright colored clothes. You may find them also being just overly active, moving about from one activity to another activity. So you could have the person start out the day, going for a jog. After that, he goes to the spa. After the spa, he goes to work, and then from work doesn't really stay long at work. He realizes he has to go visit somebody, a long-time friend or an established friend. Just busy. Those activities normally look like they make sense, but what you will notice is that it's a bit excessive. It's a bit much. Also, the person will often like start up an activity and not complete the task. So the person may start out doing something like maybe washing their clothes, and then stop in the middle of washing the clothes and go do another assignment, and stop in that assignment and go do something else. The person is easily distracted. Something new just easily catches their attention. The person you may notice that the person may be spending excessively, and this is quite important because many times when the person is spending excessively, this could be seen as being overly generous. Person writes out a check or transfers money to a loved one or a friend, and sometimes there have been cases where someone is calling in and saying, oh, help me thank XYZ because he just sent money to me. But unknown to them, that person is having a breakdown. The person may give out things, give out their phones, give out sometimes even their cars, just spending. And then the person also may go out of the house and come back having bought so many things. The the person is just purchasing a lot of things for online, going out, flat, sometimes things that they already have at home. So you may have the person just buying so much thing and just filling the house with a lot of things. And then if it is not curtailed, this sometimes may just slip, and the person literally may go bankrupt. Even if the person doesn't even go bankrupt, a lot is lost in that moment. Another thing too that you will observe in somebody who's having a manic episode is that the person may become more sexual. Sex becomes more desired, and what you call the libido is increased. And then so also the person doesn't put in attention to certain things that they will, maybe protective measures that they will normally do on a good day. The person throws that into the wind. There's excessive what is referred to as unhealthy behavior. Not that sex is unhealthy, but like maybe drinking much, smoking much, more than usual. The person just goes into very risky behavior. I think that's what I'm looking for, not unhealthy. Risky behaviors are basically increased. Also, in those periods, you will notice that the individual begins to talk a little bit more than usual. They are moving from one subject to the other. Now, it's important to note that when that is going on, they often are able to, what they are saying makes sense. There are mental illnesses that when the person is talking, they don't make sense. But in mania, the person is making absolute sense. So to the untrained person, you may mistake that to look like all is well, because the person is going from one topic to another, but making sense, talking very clearly, and making their points very strongly. In those moments too, you have something that's referred to as an inflated sense of self-esteem, where the person feels that their opinion needs to be heard, feels that their ideas are so fantastic, so bright, so fantastic, so bright that they need their thoughts to be heard. And in those moments too, the individual is experiencing something called flight of ideas, which just means that so much thoughts. It's like in that moment, the person feels like they're creative. A lot of things come into their mind, and for them, every thought is exciting. Every thought is like original. Every thought is like they need to be heard. And then for some people, in those manic episodes, they have things like they become more religious. So you may see someone going about expressing religiosity in more intense way. The person may begin to make claims like, oh, I'm a prophet, I'm a special breed, I've been sent by God to proclaim, to speak to people. And in the midst of all of that, you may notice the person just making a lot of phone calls, sending a lot of messages along that line, trying to get what they believe is a great idea out there. And in those moments, the person has a very high sense of self-esteem. They feel really, really good with themselves. Really, really good. It's and that's why it's a bit tricky, because in those moments, the person is like, I'm having the best time of my life. The person may even experience visions, may tell you that, oh, I had a vision, an angelic vision, or a vision of some sort that kind of strengthens their belief that they've been specially called to do something special in that moment. And in that's what we refer to as a grandiose idea. The person may feel like, oh, my voice needs to be heard. I have been sent as someone that will speak to maybe presidents, to governors, to statesmen, people in authority. I have this great idea for them. I'm going to change the world. I'm going to change my state and all of that. Those things, they come and they are rushing in that moment, and the person, like I said, is having the time of their life. Now, what is tricky here is that the person often doesn't believe that all of this behavior, the excessive spending, the excitement, the that the expression of their ideas need to be curtailed in those moments. They just feel like, I need to be heard. You know, I am saying something very profound here. I'm saying something very powerful. I know what I'm saying. I'm in control. And that can be very risky, because many times in that state, people don't know what they are doing. But I you know, as I begin to, I'm waiting for questions. I mean, if you have questions, it's time to start sending them in. We are already halfway done, you know, so you can send in your questions specifically on this subject, or just generally. So how they are so running through those things and just summarizing them in brief, like in points. I've explained them, but in points, these are the 7 key things that you will notice. First, an inflated self-esteem. Second, a decreased need for sleep. It's very classical for people with mania. People with mania often will sleep 3 hours or less, and sometimes just before the manic episode. Okay, Bianju asks, how do you manage mania? I'm going to talk about that very briefly. Thank you for the question. Now, just before the episode, they may have a change in their sleep pattern. So you may have the person finding it difficult to fall asleep, you know, staying up through the night, sometimes even now getting sleep during the day, and there's like a distortion just before a full-blown manic episode, because mania kind of progresses. There's something called hypomania, where the person is beginning to have those symptoms, but they are not severe enough to maybe warrant hospitalization. Sometimes when mania gets really out of hand, in fact, most times when mania gets out of hand, the person would often require to be admitted. So there's a decreased need for sleep. And classical about the need for sleep is that the person sleeps less than 3 hours, but wakes up energized, wakes up full of energy, feels like, doesn't feel tired, doesn't feel like I've not had enough sleep. If anything, they feel like, oh, I have had enough sleep. Some people even may say that, oh, you know, people who are great don't require sleep. That's why they are not sleeping well. Remember, I said that in those moments they have a high sense of who they are, so they may feel like, I don't need to sleep much. And normally while they are awake, they busy themselves around the house noisily, and some just basically disturb others. You know, they may want to go for a walk, you know, in at about 2 a.m. or 3 a.m. you know, and they may even just want to wash clothes and just watch TV or play loud music at about that time. Another thing is they become more talkative. So first I said there's a inflated self-esteem, decreased need for sleep, more talkative than usual. There's flight of ideas. Ideas are just flying, and in the flying, what I mean by that is that it's like a rush of ideas. The person is experiencing that. Then number 5 is that they're easily distracted. Attention too easily drawn to unimportant things. So some things that are not very significant, they are easily, sometimes they experience something we call being intrusive. So two persons may be having a conversation, and someone who's having a manic episode will just butt into their conversation and jump into their conversation uninvited, sometimes even to complete strangers, doesn't know them before, may just want to just, you know, have a say in their own conversation. And also sometimes you also have the person easily irritable, and then you have the person also restless, pacing, can't just really stay in one spot, just moving, just constantly. It may be moving up and down the house, or may just have a need to just arrange things and put things in order, you know, and just put things together. That also is a sign. Then there is increase in goal-directed activity. This looks like a good thing. So the person has great ideas coming, the person has plans coming, you know, and then maybe has an event coming, or a business thing. So there's like a drive to do those things. There's so much drive to do those things. But the problem there is that decision making is a bit impaired, because person can be easily distracted. And then finally, there's increased involvement in pleasurable things. Once you have 3 of these things present, you know, and if there's irritability 3 or 4 of them present, then lasting up to a week, then you have a full-blown mania. But if it is quite excessive, even if it's not up to a week, that's a manic episode occurring. So to answer your question, Obanju, mania is majorly managed with medications. Now there are other things you can do that can help. Having a structured life, a structured timing can be of great help for someone who is struggling with the issue of mania. Now, structuring your activities goes as far as structuring your time of medication, structuring your sleep time, because one of the things that triggers a manic episode is lack of sleep. It is one of the symptoms that shows when the person experiences mania, but it's also it's one of the things that could trigger a manic episode. So it's a symptom and it's a trigger. That's lack of sleep is a symptom and a trigger. So those are things that you can do, and it's very important that if you have a loved one who is experiencing this thing, or you are experiencing this thing, it's very important to understand that one of the challenges that occurs during a manic episode is that in a manic episode, people say things, do things that may be quite hurtful to the people around them and may be quite destructive to the people around them. Realize that it is just an illness. It's not something that if one is experiencing, it should be ashamed of, because it's like saying I should be ashamed of my diabetes. Yes, it is a more it's an illness with a bigger level of stigma. I do not doubt that, and I can't argue with that. But it is not something to be ashamed of. It's something to be informed about. The more informed you are about of the condition, the better you are able to manage yourself. Have a structured life, have structured activity, watch out for these symptoms, lack of sleep, talkativeness. The unfortunate thing is that when it's happening, the individual doesn't notice. It's usually the people around them that notices that. So that's that about that. Any other questions? Please send in your questions. We have less than 10 minutes to go. Any other questions on that? Is mania hereditary or can it be acquired? Well, it's a bit of both. So it is not completely hereditary. A lot of cases of people who have mania have family members who may have suffered, either their immediate family or the larger family who may have suffered some form of mood disorder, which could range from pure depression to bipolar in itself, which is mania in itself. But there are also cases where the person has no family member who may have experienced it. It says, you suggested drugs as part of the cure for mania. Can it lead to a form of addiction if there's no control? Okay, so the drugs will not cause you to, you don't get addicted to the drugs. Then you don't get addicted to the medication. Not at all. Now, most times, more often than not, the manic episode will occur for many years. Classically, the first episode is usually about the age of 21, but that doesn't mean it can occur at any age. At any age. But the first, classically also, the first very severe case that may lead to an hospitalization will occur at about 25, 26 years. So, and there's something we call rapid cycling. If it's not managed, and if sometimes the person is not on medication, the person may start having very frequent episodes of mania, which is the excited state, destructive state, easily angry, spending, feeling like on top of the world, feeling like they are a special messenger. Thank you so much for the questions. I really appreciate the questions coming. I can take one more question before round up. So it can be hereditary. It also, well, I guess what you mean by acquired is that can it be stimulated, maybe stress? Yeah, sometimes some stressors can trigger someone having a manic episode. Also, some drugs, use of some drugs can also trigger manic episodes. And there have been cases where some accidents that involve the frontal lobe also can then lead to people having something we call organic bipolar, which is they have symptoms that are just exactly like mania, but it's arising from an accident that had occurred. Okay, someone said, hi, I have a friend who recently had a nervous breakdown. Can that lead to mania? Cause at some point was admitted for mania. Yes, so sometimes mania can result after like a bereavement. So someone can have a loss event that led to depression, and then from depression the person can sometimes tilt into a manic episode. But let me also say this: once the person has had one manic episode occurring, it can happen again, and the second time it may have nothing to do with anything going on in the environment. So the first time sometimes may be associated with something, but afterwards it may be associated with no particular event. So finally, like I said earlier, you can send in your questions to 08, that's depending, via WhatsApp, to +234, that's just the Nigerian line, 808, which so let me put it in simultaneous, let me not confuse myself. 080 84 04 7850. I'll take that again. 080 84 04 7850. Sending your questions to that number. We're doing this every Monday in the month of April between 7 to 7:30, live on Instagram, on my Instagram page, I am PDoc, and also live on Facebook on the on our Facebook page, which is the Grace Seal Behavioral Health Services Limited page. And then you could also send in your questions to info@gbhs.com.ng. info@gbhs.com.ng. Send in these questions. Now, I will be delighted, literally delighted, to answer your questions as on this subject. You know, and I do encourage us, spread the word, tell people about it. I really believe that a lot of people need to be aware of mental health issues. We cannot flog it enough. We cannot talk about it enough. I mean, it's time to kick away the stigma by shining the light of enlightenment, by shining the light of information, so that people who have this condition, or people who have loved ones that have this condition, would no longer feel helpless. You know, one, they'll be able to detect it early, they'll be able to discuss about it, and they'll be able to find appropriate help. It's quite important, you know, and be able to also understand the person who's struggling with it. Thank you so much. Thank you for joining. Thank you, everyone. So same time next week, another topic on mental health issues. Like I said earlier, I am Dr. Tifia Debbie, and this is questions and answers on mental health issues with Dr. Debbie. Have a pleasant evening. Bye. Yes, thank you, Victor. You said thank you. We'll be sending my questions. Deeply appreciated. Thank you also for logging in. Most grateful. And thank you, Bob, for logging in too. Thank you so much. Thank you. I see you. Thank you, Ade. Thank you. Thank you. Have a pleasant evening, everyone. Bye for now.